Thanks, Jonathan. I'm going to focus on three. I mean, there's so many out there, but I want to focus on the sort of what I call the big three that are out there, and then also just talk about how I use them. So this is really going to be primarily an off-label discussion, although we're going to just briefly mention what the FDA indications are. We're going to start with probably the most popular, hyaluronic acid, and as you know, probably the two big ones out there are JUVEDERM and RESTYLANE, with with Ultra Plus and PERLANE being thicker products out there. And just to emphasize once again, it's FDA approved for nasolabial folds. So the great thing about this is this is part of the resident lecture part, is biosynthetic, biocompatible, and biodegradable, lasting probably about 3 to 8 months, although it could be shorter or longer depending on the person. And since there's been some antigen changes in RESTYLANE since 1999, the allergy profile has gone down to about 0.3%. What's so great about this is that I love hyaluronic acid because it's reversible. I mean, that's just so fantastic, especially if you're just starting out in your injection practice. The benefits, really the bottom line is it can be used for anything. I use it for volume, for lines, for lips, periorbital, and for the hands as well. It's fantastic, and it's reversible. I have no financial affiliation with any of the companies. The limitation is an allergy, but the great thing is it's so rare. I've only seen one, and when that happened, I can just dissolve it. So that makes things extremely easy to use in terms of hyaluronic acid. It is clear, so if you put it too close to the skin, you can see what's called the Tyndall effect, which is a bluish hue. You can either nick that if you're right there or just dissolve it. So you want to stay a little bit deeper. I tend to go into the deep dermis or into the superficial subcutaneous plane. And if you're working in the periorbital region, you want to stay submuscular. In my talk, I'm going to combine with my JUVEDERM RESTYLANE talk some of the more advanced principles of volume restoration using cannulas, a cannula I developed, and so that will be merging the next talk on upper mid-face with my talk on JUVEDERM RESTYLANE. And as I said, just to reiterate, all you need is some vitreous or hyaluronidase to dissolve the product. By the way, from a practical standpoint, if you have just a little bump you need to get rid of, I usually use extremely little, like 0.05 cc's of the vitreous to maybe 0.1. If it's a big lump, like I had these ugly lips that I saw in my office yesterday, I had it from somewhere else, I put in just like 1 whole cc just to get rid of the whole thing. Here's some results, and this is just understanding volume. She's a 38-year-old lady. The after is actually on the left, after another physician treated her lines in her lips, and I don't think the lips look that great, and I don't think the lines did very much. So I've moved away from thinking about lines and really thinking about volume reconstruction, which is so much more profound. And what I try to do is pull women in particular away from the mirror, because the number one thing, almost 10 out of 10 women when they come to me, they're bothered by the little lines around their mouth. I can't even see them. So we have to think globally, and when you look at the before and afters with fillers, I try to show full faces, because that's how you see each other, not the little micro shot of a fold. How do they look when they walk in your office? And so I do a lot of fat grafting. I think it's the principle of what I do. These are just examples of fat grafting now. A little bit of upper eyelid, upper blepharoplasty, but that's no bag. That's just hollowness. I just filled it and a little plasma resurfacing. And you can even slim a face with fat, and that's just, there's no fat, there's no facelift. I do facelifts obviously if the neck is hanging, but that's just recontouring with fat grafting. So I have a very volume-centric perspective, and that technique I'm going to elaborate more in detail when I go to my second talk on JUVEDERM RESTYLANE at the tail end. Again, this is actually widening the face, the opposite of what you saw. She's already had a brow lift and a facelift on the left at 49, but it hasn't addressed the problem, which is volume. So let's go back to fillers here and talk some more about some examples to show you, just to have you think about this. If you really look at her nasolabial fold, it's deeper, but she looks so much better. And that's because I did volume contours and didn't touch her lines. And here's another thing. You look at on the left, your eye probably perceives nasolabial folds. What I perceive is volume loss. And this is not treating any of the folds, just adding volume. Because remember, when you use product, it's so expensive that, yeah, you could fill everything you want, but it's not cost effective. So in my second talk, I'm going to help you rethink what you see and focus on what counts. Also, RESTYLANE is fantastic for hands, although I'm moving toward RADIESSE now, and I'll talk about that in my, well, a little bit in this talk. Let's talk about RADIESSE, or calcium hydroxylapatite. It was FDA approved in December 2006 for nasolabial folds and HIV-related atrophy. I've used it for about 3 or 4 years now on everything as an off-label technique. It is biosynthetic, biocompatible, biodegradable. I really haven't seen any allergies. There are some areas that it's not great for. We'll talk about that in a moment. The thing that a lot of people talk about after 3 or 4 months is, I can't feel it, so it must be gone. Sometimes it is. Some people do absorb it after 3 or 4 months, but there's a limited palpability after that period, because the gel carrier absorbs, and then the tissues begin to infiltrate, oftentimes not exactly one-to-one. That's why sometimes you can't feel it after a few months. But it does stay radiopaque, it does linger forever, it's there. Even though the aesthetic benefit may be gone in 8 to 12 months, the product is still hanging around for sometimes years. The point that the company tries to emphasize is, if you're using the product away from bone, you're not going to get ossification. So you don't want to put this product right onto bone. That's a no-no. I just sort of mentioned this already, which is the idea that the product is only a smaller component of it, and over time, as the gel carrier that holds it and as the delivery mechanism dissipates, your tissues start to ingrow and you can't feel it. And you may need a touch-up at this point if there isn't a one-to-one ingrowth of your own soft tissue into the product region. It comes already pre-packaged. There's a 0.3 and 1.3 cc syringe. They're a little bit overfilled by about 0.1 to 0.2, and you just store it at room temperature. Comes like a white paste. This is a key point. I know the company at times emphasizes intradermal injections, and if you're doing great intradermal injections with this product, I'm not going to tell you to change, but I'll tell you that if you're just starting with this product, do the subcutaneous plane. And I'll tell you, even if you're an experienced injector, I've done thousands of Radiesse, I still stay subcutaneous. It's so much safer. I would really highly recommend not getting intradermal with this product. It's not a safe thing, and it's not reversible. That's the problem. Although what I try to do, if I do Radiesse, is I see my patients back at about a week, because I can still mold the product. After about a week and a half, you're pretty much stuck with what you've got. So if you're just starting out with Radiesse, see them back in a few days. Make sure you can sort of massage it if you're not happy with where you are. Oh, and also, as I mentioned here, stop before you come out. When you're coming out, you can get it intradermal, and you get this lump of white stuff. And so, of course, you can pick out that area, but just be careful with that. There are areas that I would, in my personal estimation, would warn you about. I think it's a great fill for deep volume, for deep lines, and for hands, but I would warn you about periorbital injections. If you're getting great results, fantastic. I have had some problems around it with erythema, with some lumpiness, no matter my injection protocols, and I don't like in the lips. I've had about 5 or 6 cases where it just was a nightmare. So I would just tell you, those are 2 areas potentially to stay away from, even if you're an experienced injector, unless you're getting great results. For the hands, a technique that actually Tom Zekas introduced to me, I think is fantastic. I mix it with about 0.2 of lidocaine. I swish it back and forth with a syringe, and I put it into the hands in just big globs of aliquots, and I smear it out. And I honestly think it's the best thing I've seen in hands. It beats Restylane from my personal perspective. And again, I have no financial affiliation with any of these companies. So just to reiterate some of the key points in terms of pearls, stay away from periorbital, stay away from lips. Stay and remain in the subcutaneous plane. One thing I found is when you're injecting the medial fold or the labial mandibular fold, it's easy to get the product into the mucosal side, so be very careful. And if that happens, always go back, take one finger inside the mucosa, and just make sure there's not a ridge of product in the wrong place, and if it is, you just push it, and it comes right where it is. Again, to repeat here, at 1 week, go back and just make sure your product is okay, because you can mold it up to about a week. These are just typical nasolabial fold fills, as you can see. Some volume restoration, and I did a little JUVEDERM around the eyes, and this is just Radiesse into the mid-cheek. This is HIV lipoatrophy. This is taking about 3 syringes here, 1.5 aside. And this is the Radiesse in the hands. This is actually 2 syringes aside. I think it's a fantastic fill. Polylactic acid is marketed as SCULPTRA. It's really FDA approved for HIV lipoatrophy. As an off-label indication, it's really for panfacial volume loss. It comes sterile, freeze-dried. You reconstitute it the night before with 4 cc's of sterile water. And then what I do is I add about 1.5 cc's of lidocaine with a little epinephrine, 1 to 100,000, right before I do the procedure. You don't want to shake it, you want to swirl it, and then you go ahead and draw it up. So just to reemphasize, you want to reconstitute this the night before. And it's stable, quote unquote, for 72 hours after. I don't have any experience using it longer than that afterwards.